Thank you so much, Tuesday, again. Really, what an inspiring way to kind of start the morning. And I also just want to extend my deepest thanks to the Hogg Foundation for being such an amazing partner in this work and hosting this very important conversation here today and being a supporter and partner to so many of us in the room. So thank you so much, Linda, and the Hogg Foundation. As Linda said, I'm Ann Beeson, and I'm the Executive Director of the Center for Public Policy Priorities. We believe in a Texas that gives everyone, every person in our state, the chance to succeed in life. That's what it's all about. We believe in a Texas where everyone can be healthy, can be well educated, and can be financially secure. And what we do is we use research and data to advocate for specific solutions so that all of us, all Texans, can reach their full potential. We have a wonderful origin story, which I love to tell, and it seems particularly appropriate in the room here this morning. We were actually founded by a group of Benedictine sisters from Boerne, Texas.
Right on. All right.
And these sisters had a deep spiritual mission about caring for the poor and helping the poor gain access to health care. And they were kind of ministering in hospitals and in clinics. And you know what? They actually got fed up. They got fed up because they saw that just by kind of caring for the sick, they weren't going to solve the problem, the structural problem of, low-income people not getting good health care that would help them be, live healthy, longer lives and not end up kind of sick and old in these clinics and hospitals. And so they said, you know what we need? We need a public policy foundation. We need a public policy organization. And so they founded what has now become the Center for Public Policy Priorities. And CPPP continues to be very dedicated to, of course, expanding access to health care and especially as well to mental health services and care. And our dedication to these issues really continues, and I want to kind of return to this theme, the spirit of innovation and commitment to problem solving that those Benedictine sisters from Boerne started almost 30 years ago, right? I am personally very passionate about this issue that we're here to talk about today, peer support in jails, for a couple of different reasons, which I just wanted to share with you. In addition, of course, to our strong history as an organization in supporting this kind of work. For many years, I was a civil rights lawyer, and I worked on criminal justice reform issues for many years, and saw how horrific it was that we were locking up people who were sick and who needed help, either because they were living with mental illness or because they were dealing with substance abuse problems. And I saw just how backwards it was that, it felt like, the more I learned about it, the more I felt like, God, are we living in 19th century Victorian England? Like, how could it be that as a society we had made these choices, right, which were so bad for everybody? And so I had been very passionate about these issues because of the overlap, with the criminal justice system. And also I'm very passionate about this issue because I had the opportunity to work on a remarkable project earlier this year, and there are several, I shouldn't say partners in crime, that's a bad metaphor, right? Several co-conspirators, I'll use that one, in the room here, Sarah and Anna Jackson from Via Hope. It was a great project. In which we were trying to shift perception about what it means to live with mental illness through an art and creative project called 4+4=. Some of you may have heard of it. What we did is we actually brought together 4 visual artists with 4 mental health peers. And we gave them the opportunity to co-create works of art that told their story and helped to spark a conversation like the one that we're having here today about what it actually means to live with mental illness, and most importantly, the very real possibility of recovery. And so that was kind of my first experience in getting to know, and it was such a privilege and an honor, directly a number of mental health peers that are working here in Austin. And that was a project, again, that was supported by the Hogg Foundation, which I'm very grateful for, and that Via Hope and the Fusebox Festival, an art festival here in town, were partners on. And what I learned from these remarkable people was that it is, in fact, very possible for people living with mental illness to live very normal lives and to fully recover. And I was so struck, and all of us were that were part of this amazing project, by just how wise, just the level of wisdom among these people. You saw it in Tuesday, you heard Tuesday, and the true knowledge and expertise. Like, a lot of us, we make our living, we read books, we're whatever, we're like lawyers, we're policy experts. Well, these are the real experts. These are the people with the true knowledge, right? And because they have had this lived experience, they are the best people of all. So many of you in the room know this because you're doing it yourselves, to help others find the way. One of the other components of this project that I was very moved by is we ended up doing short audio interviews of the peers, and it allowed them to tell their stories. And one of those peers was a man named Richard Allen White, who's a peer at the Austin State Hospital here. And he says in his interview something I think very powerful and very moving. He says, well, one of the reasons that I volunteer, right, as a peer is because I know the way out of the desert. And I might forget the way if I don't show it to others. And I mention that because this is such a remarkable therapeutic and healing opportunity for people living with mental illness. It's also an amazing therapeutic opportunity for the peers themselves. And Tuesday, you touched on that even in your own remarks, that it's helping you on your own journey. So having been part of this amazing project and learning and getting to know these peers who just had so much wisdom and knowledge about what needed to be done, I'm kind of in my office one day, I don't know, early winter this year, and enter the brilliant mental health policy analyst, Catherine Ligon from the center, and Megan Randall, who's here in the room, and they come in and they say, we're thinking about the possibility of proposing peer support in jails in Texas. What would you think about us kind of producing a report, doing a lot of research, studying what other states have done, and trying to spark, ultimately, an actual project to get this kind of program into our jails and prisons in Texas. And I said, right on, let's do it. It was so clearly made so much sense from everything that I knew from my, being around the edges of this issue and having the opportunity to meet such wonderful people who were helping others. So I don't want to say much more because Catherine is the true expert, and she's going to tell you much more about the components of what this kind of project could look like and what we need to do to get there. But I do want to really, and I know that I'm in a room full of people who are already there, so I'm just gonna, this is my life, get up off your feet and get to work. I mean, I would just return to my opening story, which is, if a group of Benedictine sisters can help to expand access to healthcare for literally millions of people in Texas, which is what they have done through creating the center and their own work, and if people who have been incarcerated because they are living with an illness that any of us could be living with, just like that, right? If they can overcome that and have the power to minister and help others to recover, then we, the public policy experts in the room, the foundation staff, the lawyers and the advocates, we can do our little part, which is to help create a climate in which this program can become the norm in Texas jails, and we can break this cycle. So I encourage all of you to join us on this journey, and I'm just so happy to be here and be a part of this. Thank you so much.